but to meet that demand, you've got to really deliver on the service and make sure your specialty schedules are full and really leaning in from that perspective.
So, what were some of the roadblocks that you experienced that you wish you would have known about before?
Yeah, I think we took a lot of what we learned going into different regions in Texas. Because remember, like that first, when we went from Fort Worth to South Texas, I mean, that's an hour and a half flight,
Yeah.
right? So, the first thing you kind of do is you learn operationally how to build the teams, and you take your A team and you take them to the new region, and you kind of do these rotations of 1 to 2 week with your A team there, training the team that's currently there. But you got to study. I mean, obviously, state to state regulatory stuff changes, the nuances of how the insurance is run, how dental assistants and auxiliaries can do different functions. So, all of that learning curve, I think, is important. And then starting a new brand in any new region, whether it's South Texas or a new state, you've got to get ahead and really 6 months out start to build the marketing and really make sure you've got the momentum so you can launch the practices in a strong way out the gates.
How many new patients do you, which you're in a de novo in a new state? What was like your month one new patient target? I know that's kind of in the weeds, but I'm just
Yeah,
curious.
no, it's a great question. I mean, typically, and I think you'll see this across a lot of practices around the country. Your larger cities, your Denvers, your Dallas, your Houston's, typically will take a little longer to ramp because there's just much more competition in those areas. There's
Yeah.
more practices. But then, like when we went into Greeley, which is in uh, north of Denver, um, man, we were a huge hit because there just wasn't a lot of practices out there. It's kind of a rural area. Most people had never seen a practice like Rodeos ever before, where
Oh,
you've got
okay.
this lobby, and I mean, it's really a big presence that shows up, and then you incorporate all the specialty. I think in the first couple months we had over like 500 patients come in to the doors. Right. So huge hit, right? But to meet that demand, you've got to really deliver on the service and make sure your specialty schedules are full and really leaning in from that perspective.